Yeah, my name's Paul Severson, and I'm the director at the Minnesota Reflux and Heartburn Center. I've been a surgeon by training and trained at the University of Minnesota Medical School, Hennepin County Medical Center for a residency program, and also spent some time training at the Mayo Clinic during my surgical training. Ambulatory pH monitoring is so important for the patient who's suffering from reflux disease. In the past, we have gone in with an endoscope and taken a look and made judgments based on that. But we found out that's really not adequate, nor is it scientific. We like to do ambulatory pH monitoring, and what that means, pH is how we measure acid. And our favorite technique is really painless for the patient because we install a little wireless capsule called a Bravo capsule at the time of their endoscopy. And then they go home with this for 48 hours and it monitors what happens in their life during the day, while they're sleeping at night, what they eat and drink, and how that affects acid reflux in their life. We bring that back and hook it up to a computer, and then the patient is able to find out whether they really do have reflux and how serious the reflux is. Well, it's very important because, first of all, about 30% of patients in the United States are on long-term drugs called proton pump inhibitors, and these medications can have serious side effects. There's many concerns about this on the part of our patients now. And we feel that any patient who's been on these long-term, or maybe doesn't feel like they're completely happy with how the drugs are working, should have an ambulatory pH monitor. We not only have the wireless technology, which is painless, but we also have two other types of technologies that are used for people who have reflux symptoms that aren't necessarily heartburn. They could have cough. It's chronic cough, coughing at night. They could have hoarseness in their voice, regurgitation symptoms up into their throat and mouth. And these patients may not have adequate testing with conventional pH monitoring. We have two other technologies here at our center to be able to test people with all types of symptoms. Well, the concern that we have over about people who are taking these medications is that there may be changes taking place in their esophagus that they're not aware of and that is being covered up. What I'm specifically referring to is advancing reflux disease leading to a condition called Barrett's esophagus. Barrett's esophagus is when there's precancerous cells developing and which can eventually become esophageal cancer. Esophageal cancer right now is literally epidemic in our country. It's going up faster than any other cancer, and the cause is reflux. I can say that what we are able to do here at the Minnesota Reflux and Heartburn Center is comprehensive. There's literally no procedure that is not offered to the patient, and it's tailored to each individual patient based on all of the testing that we do, most important of which, of course, is the pH monitoring. Well, we're doing about 500 ambulatory pH monitoring studies now per year, and there's probably over that maybe 600, 700 patients per year that are coming here looking for help. This translates to procedures as well, and the procedures are approaching about 200 curative procedures per year that we're offering the patients of Minnesota. I think it's important that when people have been struggling with symptoms and their doctors have been just trying to provide more medications, and these medications really are not working to the satisfaction of the patient, or they have a history of esophagus cancer in their family, or they've been told they have a large hiatal hernia and the symptoms aren't under control, it's time to check it out. It's time to come in, get tested, find out, get a real scientific answer, and find out whether this is something they should be concerned about or whether we can just help them improve the way that they're being managed.